talk about designing resistance training programs. So some definitions that we need to cover before we talk about resistance training program is intensity. And intensity regarding resistance training program is defined as typically percent of one repetition max. And intensity is inversely related to the number of repetitions. The higher the intensity, the less repetitions. And for muscular fitness programs with a goal of strength development, generally the intensity is recommended to be 60 to 100% of one repetition max. These higher intensity programs result in less repetitions. These are lower volume programs versus muscular fitness programs designed to improve muscular endurance. The repetition max is generally less than 50% of one repetition max. These are lower intensity, higher repetition programs or higher volume programs. Set is a specific number of repetitions for a given exercise, and the number of sets depends on the client's goals. And a set, for example, of bicep curls would be a 10 repetitions and a person would rest, and then another 10 repetitions. That would be 2 sets of bicep curls. And for a novice or intermediate lifter, the general recommendation is 2 to 4 sets of a particular exercise. Frequency is defined as the number of times an exercise or resistance training program is performed for a specified period of time, like 1 day per week or 3 days per week. And the general recommendation is that there should be 48 hours rest between workouts for a particular muscle group, and this allows for optimal muscular adaptation and prevents overtraining. Training volume is defined as the total weight lifted in an exercise session and can be calculated as the number of weight lifted multiplied by the number of repetitions by the number of sets. Progression is something that we can talk about regarding training volume, and progression is important to preventing training plateaus. It ensures that we progressively overload our participant so that they continue to adapt and improve their muscular fitness. And progression is related to increases in volume and also increases in intensity of a particular resistance training program. There are 9 different variables that can be modified when we're thinking about designing a resistance training program, and these variables will be determined depending upon our client and depending upon the goals of the program, whether the program is for performance goals or to improve performance versus to improve health. Generally, a program to improve performance is going to be more intense. The person is going to train more frequently, and it requires more specific muscular actions versus a program that is designed to improve muscular fitness health. That program would be more moderate, more general, and generally of a lower volume and intensity. So we're going to talk about each of these program variables and how to use them to design a resistance training program. And we're going to talk about them as in the context of these 7 steps to design a resistance training program. And the first step is to perform a needs analysis, and then we'll talk about the sequential steps. So the needs analysis, the important things to evaluate are the muscles and joints involved. Is it an overall muscle and joint? Are we trying to avoid muscle injury? So we're trying to strengthen the glenohumeral joint or strengthen the knees to avoid knee injuries. The physiological needs of our participant, strength improvement versus endurance improvement. Do they have any injuries? Are they susceptible to any injuries? So are they susceptible to ankle sprains? Are they susceptible to knee injuries? And also the needs analysis should involve assessment of the participant. This allows us to design a more individualized, more specific training program. And so when we assess our participant, we need to think about the training status, the exercise technique experience of the person, and this can help to guide whether we determine or what type of a resistance program we recommend, whether it's a weight machine assisted or a free weight program or some combination. Also, training intensity depends on the participant. If they're a more novice training individual, their intensity is going to be much lower than if they're a more advanced resistance training person. Do they have any injuries or physical complaints? Knee injuries, glenohumeral injuries, and any kind of physical testing results that we have. Were we able to perform a muscular endurance or a muscular strength test? And how does the upper body and the lower body strength and endurance compare? How do their values compare to norms? It helps us to identify any muscle imbalances, upper lower body, contralateral, antagonist or agonist muscles, and it allows us to focus on those exercise or those muscle groups that were poor or fair muscular fitness. We can improve the muscular fitness of those muscle groups versus muscle groups that are good or superior. We don't need to spend as much training time improving the fitness of those muscle groups. So it helps us to target our training of particular muscle groups if we are able to use our muscle fitness testing results. In terms of the person, we can use the resistance training status defined by the National Strength and Conditioning Association. In that description, a beginner is someone who's been training for less than 2 months. They have none or minimal skill, versus someone who's intermediate resistance training and they are currently training. They've been training for up to 6 months. They're able to lift a medium amount of weight and they have basic techniques and skills training, versus someone who's more advanced and they've been training for over a year and they're able to lift a high training load and they have a high skill and experience lifting. And so you may find that your person is a beginning lifter with some lifts, or an intermediate lifter with other lifts, or you may find some combination of these different classifications for your individual. But this gives you a very basic place to start when you're thinking about designing their resistance training program. When you're doing a needs analysis, it's important to guide your resistance training program design and also to help your person to guide their goals by helping them to develop SMART goals. Specific, are they trying to improve muscular fitness or muscular strength or muscular endurance? Measurable goals, do they want to be able to perform push-ups? How many push-ups? Are the goals realistic? Are they timely? How long do they want to train before they can obtain those goals? And that helps you to guide the resistance training program. It also helps your person to focus on the training goal, and it also helps you to monitor their program and helps you to demonstrate that they've attained their goals so that they can see progress. The next thing you want to think about is exercise selection. And very basically, you want to make sure that the exercises involve primary muscle groups. And you can think about exercise selection in terms of core exercises, and core meaning central, not necessarily those exercises that support the spine, although those are often central exercises or core exercises in this case. Core exercises generally involve multiple joints. And these exercises are priority exercises that if you have limited time, you should be sure that you perform these exercises. So you essentially build your program around these core exercises. Versus assistance exercises. Assistance exercises are generally recruit smaller muscle groups. They involve one primary joint, like glenohumeral joint or elbow joint. They're often used for injury prevention or rehabilitation. Core exercises are generally two types. They're structural exercises. These involve loading the spine directly, stabilizing the posture, or power exercises. And power exercises are structural exercises that are performed very quickly. And all versus movement specific exercises, these are core exercises or central exercises that are activity specific. So those exercises that are more likely to improve performance, if performance is a goal of the muscular fitness training program. And movement specific exercises are designed to maintain proper muscle balance ratio, so proper antagonist and agonist muscle, proper contralateral muscle balance, so that your person doesn't end up with a agonist muscle that's very strong and an antagonist muscle that's very weak, and that would compromise joint stability. Exercise selection is based on the level of training status of your person, their familiarity with specific exercise movements, their primary training objectives, and the availability of equipment and training time available. For example, you could think about exercise selection if it's between free weights versus constant resistance machines. And the advantage of free weights are that they involve or they challenge neuromuscular coordination. So they increase neuromuscular coordination. They allow full range of motion. They're more sport specific. But the disadvantage is that a spotter is often required, and they tend to be more time consuming than training using constant resistance machines. So constant resistance machines might be used for someone who's a more novice lifter. It's because they require less balance and coordination, so they can focus on the muscle movement. They're easier to use, they don't require a spotter, and they generally can be performed more quickly. One of the disadvantages of constant resistance machines is they limit the range of motion, and not everyone can fit into a constant resistance machine. So they might not be optimal movement pattern for some individuals. You also, when you're thinking about exercise selection, you want to make sure that you are changing the muscle action so that you're changing the way the muscle is activated. For example, you want to alter body postures, grips, hand and width, and foot stance. And these position changes change the way the muscle is activated. So they change the muscle activation pattern so it's a more fully developed muscle. So you could think about multi-joint versus single joint exercises. Multi-joint exercises are going to involve more joints, more musculature, and they're important in increasing metabolic demand of the muscle training session. Also, they increase anabolic hormone release, so that they're important in increasing muscle hypertrophy, increasing muscle strength, versus single joint exercises. You could also think about unilateral exercises versus bilateral exercises. Unilateral exercises, when you're using one arm versus two arms, like for example a one arm biceps curl versus a two arm biceps curl, one arm can perform more, or the force that can be lifted with one arm versus two is greater. So you can curl generally more with one arm versus if you're doing a bilateral biceps curl. And it's not exactly understood why that is true, but it's different. Also, you could think about using unstable environments like stability balls, wobble boards, or Bosu balls for training. Unstable environments challenge the ability of your person to maintain a neutral spine while they're lifting weights, but generally when you train your person on unstable platforms, they don't produce as much force. So these types of exercise, while they're important in training spinal stabilization and improving balance. Generally, less force can be produced because they're more neuromuscularly challenging, so they're not optimal for developing muscle strength. You'd also want to think about training frequency, and this is the number of training sessions completed, for example, per week. Generally, this should be about 2 to 3 times per week, and it includes the number of times certain exercises or muscle groups are trained per week. So even though you're doing 2 exercises and 2 sets of training, you want to make sure that to train a muscle group, you should train it at least 2 to 3 times per week, irrespective of the number of sets and the number of repetitions you're doing for that muscle. So muscle groups should be trained twice a week at least. But if a person is better conditioned, then you may increase the training frequency up to 4 times. But lesser trained individuals may need longer recovery periods, longer than the 48 hours between workouts. But generally, it's recommended that resistance training frequency be not more than, or the period between resistance training not be more than 3 rest days. And that's to allow the blood pressure and blood glucose sensitivity effects of a resistance training program to not let them go away completely. That was really awkward, but essentially you shouldn't allow more than 3 rest days between resistance training bouts. You also want to think about exercise order of the program, and that refers to the sequence of exercises within a single training session, and this affects the performance of sequential exercises. So if you were to perform a chest press and a triceps kickback, so in the chest press you're training the triceps, and the triceps kickback you're training the triceps, and if you were to alternate those exercises, essentially you would fatigue your triceps, and that would eventually limit the amount of weight that you could chest press, or limit your ability to train your pectoralis muscles. So you can think about exercise order. There are 4 common methods. You can think about using power and core exercises first, and then performing resistance exercises. Or you can think about performing upper and lower body split exercises. So that first you perform an upper body exercise, and then you perform a lower body exercise, and that allows your upper body to rest while you're performing the lower body exercise. This is good for untrained individuals. Less time's required, so you don't need to have essentially a rest interval between exercises. You can continue training upper, lower body without fatiguing musculature. And you could also use circuit training. And circuit training is where, so it's a dynamic resistance training, and circuit resistance training is important to increasing strength, muscular endurance, and cardiorespiratory endurance. And generally, in a circuit resistance training program, you have 10 to 15 stations as a circuit. And what you would like to do is, for 30 seconds per station, you perform the number of repetitions to fatigue the muscle, and then there's a short rest as you switch stations, like a 10 to 20 second rest, and then you move to the next station, fatigue the muscle groups in 30 seconds. And generally, circuits are you rotate through circuits 2 to 3 times per exercise sessions, and it takes you about 20 to 30 minutes per sessions to rotate through the 10 to 15 stations. And they're good for strength development if you use low repetition, high intensity exercises enough to fatigue the muscle in 30 seconds. And they're also good for those with time limitations. A super circuit is a circuit with aerobic stations between weight training sessions. So if you had 10 to 15 stations and those were interspersed with, say, marching or a bear crawl or a farmer walk with weight, and so those, or jumping jacks between individual weight stations, and so something to get the heart rate up, and then as you move to the next station, and that would be a super circuit. You could also use alternated push-pull exercises, so a chest press and then a row would be an example. These are good for untrained individuals because they allow you to alternate agonist and antagonist muscle groups. Less time is required because you don't have to sit for the minute or 3 minutes between exercises. You could also use supersets and compound sets. And so supersets and compound sets are, a superset is 2 exercises that stress opposing muscle groups. So that would be like our push-pull example, versus a compound set involves 2 exercises that exercise the same muscle group sequentially. So like we had, example, a push-up and a tricep dip. So both exercises are challenging the triceps and could potentially fatigue the triceps. These are more demanding and they may not be appropriate for beginners because it would be more likely that their chest press would be limited by their tricep fatigue from the tricep dips. But generally, when you're thinking about exercise order, you want to vary the number and order of exercises, but you want large muscle groups or your person to perform large exercises that challenge large muscle groups before smaller muscle groups, so they can more optimally perform those large muscle group exercises. The large muscle group exercises are also associated with more of a hypertrophic response or more of a metabolic stimulus than smaller group exercises. So you get more of a growth hormone release, more of a testosterone release if you train large muscle groups first before small muscle groups. But advanced lifters may fatigue small muscle groups before using large muscle groups, and that can be a training technique that they may use. For novice lifters, you generally want to intersperse different exercises and use multiple sets, different exercise interspersed between multiple sets for a single muscle group. So you don't want to sequentially train the same muscle group. So like we talked about push-ups and a tricep dip. And so for advanced individuals, we might use a compound set where you use 2 consecutive sets for the same muscle groups or 2 consecutive exercises for the same muscle group. And you might use trisets, and that's where you use 3 consecutive exercises for the same muscle group, so that you would fatigue, for example, push-ups, tricep dip, and tricep push down, or push-ups, overhead press, and tricep kickback. And those would all be challenging the triceps. And if you perform those sequentially, that would be a triset. Supersets are consecutive exercises that alternate between agonists and antagonists. For example, chest press and row, which we talked about. And these supersets and compound sets, like the triceps or the trisets, may not be appropriate for beginners. So exercise order, you want to do large muscle groups before small muscle groups, multi-joint exercises before single joint exercises to maximize training stimulus, higher intensity exercise before lower intensity exercise. The higher intensity exercises are more difficult to perform, so you want to maximize or optimize their performance so that you get optimal training stimulus from them, or optimal training potential from them. You want to do complex total body exercises before simple exercises. Rotate agonist and antagonist and contralateral exercises, and this allows the muscle to recover. Especially for novice exercises, successive exercises should not involve the same muscle group, and at least one exercise should be performed for all major muscle groups at least 2 times per week. And you're thinking about training load and intensity. Training load is the amount of weight lifted, and it depends on the individual training status and their goals. Load may be based on the percentage of 1 RM, or absolute load might be based on targeted repetition number. So the load that you could perform, example 12 repetition max, 12 repetitions, and then you would fatigue. And if you might increase load within a prescribed zone. So for example, your training goal might be 8 to 12 repetitions. So the first sets you might be able to perform 12 repetitions, and then subsequent sets you might be able to perform only 8 repetitions. Loads, for example, less than 40 to 50% of 1 RM and less have been shown to increase muscle strength in previously untrained individuals. So we make general recommendations for exercise load, but if someone is untrained, you're still at that very low load, you're still going to see an increase in muscle strength. And generally, load is inversely proportional to the number of repetitions performed. So the higher the weight lifted, or the greater the weight lifted, the less repetitions that can be performed. Training load or intensity depends on your client's goals and their experience level and their motivation for their goals of the resistance training program. The optimal weight training stimulus is controversial, but generally endurance, a program designed to improve muscle endurance, you perform a low weight, high repetition program, and versus muscle strength, you perform a high weight, low repetition program. So generally for endurance, it's 15 to 25 repetitions maximum. Strength is 8 to 12 repetitions maximal. And training load and intensity depends on whether your person's a novice, an intermediate, or an advanced lifter. And we'll see that as we come to the end or towards the end of this presentation. Intensity, mean optimal intensity for strength is 60 to 100% of 1 repetition max. You can generally perform 1 to 12 repetitions at these intensities, but this is modified depending on your experience level of your participant. For a novice lifter, the intensity is 60 to 70% of 1 repetition max, versus an intermediate lifter, it's a little higher, versus an advanced lifter, they can lift a greater percentage of their 1 repetition max, and that's required for them to improve strength. And you need to vary intensity to continue improvement to avoid plateaus. And generally, you should shoot to change exercises for each muscle group every 2 to 3 times that you train your person. Optimal intensity for endurance is greater than or equal to 50% of 1 RM. But again, it's modified based on the experience level of your person. If they're a novice lifter, it's 50 to 70% of their 1 RM, versus if you're an advanced lifter, it's anywhere from 30 to 80% of 1 RM. And so these training ranges are controversial, but this can give you a basic starting point for your participant when you're designing their resistance training program. And you need to vary the training intensity to continue improvement, and change your exercises for each muscle group every 2 to 3 times. 2 to 3 times you exercise that muscle group. And for endurance training programs, strength gains are usually less, although for untrained individuals, you're still going to see strength gains. So because there is an inverse relationship between load and training repetitions, resistance training goals, the optimal stimulus for strength versus endurance is controversial. Generally, strength and power are improved by high load, low number of repetitions, so 8 to 12 repetitions maximum. Generally, for a hypertrophy program, you recommend a moderate load, moderate to high repetitions, so somewhere between 8 to 12 repetitions, similar to a power training program, although rest might be a little different. We'll talk about that in a minute. Endurance is generally a low load, high repetition program, and that's 15 to 25 repetitions maximum. And it's recommended that you avoid training in one intensity. That will help you to avoid training plateaus. And intensity is often exercise dependent and muscle group dependent, and that some muscle groups are stronger than others. So for a given percentage of your 1RM, you might be only able to perform 6 repetitions max if it's 50% of your 1RM. So generally, it's recommended that you guide your training by the number of repetitions that you can perform, so that you try to guide the load that you choose according to the number of repetitions. So try to select a load where you can perform 8 to 12 repetitions maximum if you're trying to improve strength and power. Versus if you're trying to improve endurance, select a load that you can perform 15 repetitions versus 12 repetitions. And load and intensity is going to depend on exercise order. Are your muscles pre-fatigued? Exercise volume, also exercise frequency, the muscle action, the repetition speed, and the rest interval length. And so you can set your goal can be a particular repetition number, but that's going to depend on these factors. Another variable that you want to consider is rest intervals. Longer rest intervals, generally 2 to 5 minutes, are used for strength and power training. Generally, you're moving heavier loads, and general repetition is 1 to 6 repetitions, and that requires 3 to 5 minutes of rest for multi-joint exercises. And this allows for phosphagen repletion that occurs within 3 minutes. Moderate to short rest intervals are used for hypertrophy and strength training programs, generally 1 to 2 minute rest intervals. And you might be lifting moderate to heavy loads like 6 to 12 repetition of a particular exercise. Short rest intervals, less than 1 minute, are generally used for local muscular endurance training. These are high repetition programs, and they are lower loads, and they generally this short rest interval relies more on aerobic metabolism for recovery. So which rest interval you choose will determine primarily which energy system is helping your muscle to recover. So if longer rest intervals, you're relying on more anaerobic phosphagen system. Moderate to short rest intervals, you're relying on more phosphagen glycolytic metabolism for recovery. where shorter rest intervals, you're relying on more aerobic metabolism for recovery. You also want to think about training volume, and that's the volume of the load of a particular training session, and that can be calculated by multiplying the number of sets by the number of repetitions by the weight that's lifted. So if you perform 2 sets of 10 reps of 50 pounds, your training volume is 1,000 pounds. And volume can be increased by manipulating sets, the number of sets, the number of repetitions, the weight that's lifted, the number of exercises per muscle group. And volume is important to adjust to continue to improve, or to continue to challenge your muscles to adapt to improve your muscular fitness training status. Adjustments prevent plateaus in training. The number of sets that it's recommended should be targeted to your participants' goals and their training status. Generally 1 to 2 sets are good for children or older adults. 2 to 4 sets are good for novice and intermediate lifters. Single sets, shorter programs, so maybe a single set circuit program. That's a shorter program. It is good for people that have limited time available. It can increase exercise adherence. Multiple sets are longer programs, but they increase the training stimulus, and they require a greater amount of time to complete. And generally, the recommendation for improving or optimizing strength gains is that you should perform 4 sets per muscle group. So that can be either 2 exercises of a particular muscle group and 2 sets of that exercise, or it could be 4 sets of a particular exercise for a muscle group. So it can be attained 2 ways. Collegiate and professional athletes, it's generally recommended that they perform 8 sets per muscle group in order to optimize strength gains. So if we're thinking about the volume of training and the training goal, generally for strength, the goal is generally less than 6 repetitions and 2 to 6 sets. For power, generally the goal is depends on a single effort or multiple effort, 1 to 2 or 3 to 5 repetitions and 3 to 5 sets. For hypertrophy, the recommendation is 6 to 12 repetitions, and the set is 3 to 6. For muscular endurance, the recommendation is greater than 12 repetitions and generally 2 to 3 sets of a particular exercise. And so this is from your textbook, and this is very generally basic guidelines for a resistance training program, and this is for novice lifters, and this shows you a strength, hypertrophy, endurance training program, and the intensity of the weight that should be lifted as a percentage of 1 RM, the number of repetitions, and you'll notice there is an overlap for strength and hypertrophy programs, and that's because to improve strength, your muscle needs to hypertrophy, and so there's not clear delineation between strength and hypertrophy programs. The velocity, generally when you're working with a novice lifter, your goal is going to be to improve the performance of the exercise, or to ensure proper technique so they don't injure themselves. So slower to moderate intensity is recommended. Training frequency 2 to 3 days per week. And a strength training program, you have longer rest intervals, so you're trying to challenge the phosphagen system. versus a hypertrophy program. The rest intervals are generally shorter, so you're trying to challenge the phosphagen and glycolytic system. Generally, hypertrophy programs are higher volume programs, and those are more correlated with greater muscle growth, muscle hypertrophy. Whereas endurance programs, you're trying to challenge the aerobic system, and so those rest intervals for endurance training programs are generally much shorter. For power training programs, so power is the ability to produce force in a short period of time. And for a power training program, it's important to train both muscle strength and velocity. So you can see this is, you have to train essentially at two ends of the spectrum. So I'm not going to test you on this very much, but I'm just going to go over this very briefly. And that you want to train muscle strength, so training 85 to 100% of 1RM. But you want to also train maximal velocity, and maximal velocity is produced at lower muscle force, so generally 30 to 60% of 1RM. And rest intervals are generally longer. For intermediate lifters, you increase the intensity that you're training at. For strength, hypertrophy, and endurance, rest intervals are the same. The speed of the exercise is slow to moderate, and you're performing a similar number of repetitions as the novice lifter. The difference is the greater intensity, or the greater percentage of 1RM. For advanced lifters are performing a higher intensity of exercise, and now they can perform that exercise at different speeds, so slow to fast. Just gives you some general guidelines for novice, intermediate, and advanced lifters. So when you're developing resistance training programs, it's important to know your client's goals, their availability, and their access to equipment. Help them to identify a primary goal, assess their target areas, review training principles, determine how to incorporate those training principles to individualize the exercise training program, follow standard guidelines and recommendations. And so those are the tables that we just looked at. So generally for an endurance training program, you're going to perform more repetitions at a lower intensity or a lower percentage of 1RM versus a strength training program or a hypertrophy program where you're going to train at a higher intensity for a lower number of repetitions. And be aware of any precautions or specific guidelines when programming for older clients and children and people with injuries. So the training principles, as we adapt them for exercise or for resistance exercises, so think about the specificity principle. Muscular fitness is going to be specific to the muscle group that's exercised. The speed of the contractions, so if you're going to perform fast contractions, you have to be aware that the muscle adaptation is going to be at that velocity. If you perform slow muscle contraction speed, then the muscle adaptations are going to be specific to that slower velocity. Also, the muscle adaptations are going to be specific to the type of contractions: concentric contractions, eccentric contractions, or isometric contractions. Isometric contractions are going to train the muscle group at that specific joint angle. Also, training intensity, that's going to be specific to the muscular adaptations, whether you're training muscle strength or muscle endurance. Also, think about the overload principle, and that the muscle group must be exercised at workloads that are greater than normal. For strength, greater than generally 60% of one repetition max, and faster strength gains are going to be obtained at higher loads if your person can tolerate those higher loads. And generally for endurance, load should be between 30 and 60% of 1 RM. But repetitions should be performed to fatigue. And fatigue doesn't mean dropping the weight on their face, but it means compromised performance or compromised exercise performance, and that they're having difficulty lifting the weight, but they may not be failing completely. The principle of progression says that there should be a systematic, periodic, gradual increase in training volume or total amount of work that the person is performing. You can increase resistance or load, increase the number of reps, increase the number of sets, increase the number of exercises, or decrease the rest periods to change the training volume or training load. Principle of initial values. So a person with the lowest starting value, lowest value for strength, endurance will show the greatest improvement. Principle of individuality. No two persons are going to respond to the same exercises the same way. So you want to monitor programs. Principle of diminishing returns. As a person gets closer to their training goal, you're going to see smaller and fewer adaptations. So their improvement won't be as great. People who've been training, resistance training for 2 years, and this is adults who've been resistance training for 2 years, they might not be able to increase muscle hypertrophy, but they can still increase muscle strength. Although the gains that you'll see for someone who's been training for 2 years are much smaller than those gains that you'll see for people that are training within their first few weeks of exercise training or resistance training. And the principle of reversibility, that when you discontinue training, you're no longer going to, you're not going to be able to maintain that same muscular fitness level. So it's important to switch to a maintenance program if you have attained your muscular fitness goals. Resistance training for children has been shown to be safe and beneficial, but you should focus on technique. And the general guidelines, the American Association of Pediatrics, the National Strength and Conditioning Association recommend that you should start training children essentially when they can follow directions. So when you first start training children, you want to really focus on technique, focus on breathing, focus on proper lifting technique. Best results are obtained using child-size equipment. And generally, it's recommended to use machines, child-size machines, not free weights, but you can use resistance bands, you can use frisbees, you can use calisthenics. Keep intensity to less than 80% of 1 repetition max. So somewhere between 8 to 15 reps, and that lower rep range, like 8 reps, is for children that have better training technique. Children generally before puberty, the strength gains are due to neuromuscular factors and not hypertrophy factors. And so one of the important things that resistance training can be used for is to improve motor skill performance and neuromuscular development and coordination. And these might be important to enhancing sports performance of youth, although benefits haven't been supported by studies or haven't been. There's still a lot we don't know about resistance training in children, but what we do know is that resistance training improves bone density, and the maximal time of bone deposition in kids is between 9 and 14 years, and so resistance training could be used to maximize bone mass when the child is growing, and that could be used to prevent osteoporosis later in life. For older adults, follow precautions and recommended guidelines, and that or when precautions and recommended guidelines are followed, resistance training is safe and beneficial for seniors. The primary goal for seniors is to develop sufficient muscular fitness to allow safe, independent performance of activities of daily living, to improve balance, to help to improve insulin sensitivity and glucose handling. And generally, initially, it's recommended that you prescribe 1 or more sets of resistance training exercises and about 10 to 15 repetitions for 8 to 10 different exercises each workout. A good way to monitor intensity with an older adult is to use RPE, and generally it's recommended initially to start with an intensity of 5 to 6, and then for more vigorous exercise, use an intensity of 7 to 8 and have them exercise 2 or more days per week. And initially, keep loads light and focus on technique. And so, and then resistance training for older adults can also be used to improve or to prevent osteoporosis and also to prevent falls. And so it's important in the health of older adults. So these are the basic guidelines for designing resistance training programs. And then we'll also talk about the adaptations of resistance training program and then periodizing the resistance training program in the next video.